But I do want to talk a little bit more about Quebec's proposed tax on the unvaccinated, which is really just a backdoor way into a vaccine mandate. I played the clip in the last show. I have to play it again. Jean-Yves Duclos, the federal health minister, has said that he thinks provinces inevitably will go down the road of mandating vaccination. Take a look.
First, it's a view which is based on my personal understanding of what we see internationally and domestically, and in my conversations with my colleagues, health ministers, over the last few weeks. And second, it's a decision that will be made by provinces and territories at some point. Whether they move forward or not, that's going to be their decision to make. But what we see now is that our healthcare system in Canada is fragile. Our people are tired. And the only way that we know to go through COVID-19, this variant and any future variant, is through vaccination. PPE, physical distancing, tests, rapid tests, PCR tests, these are all very important tools. But what will make us move through this crisis and end it is vaccination. And I see in my own province, 50% of hospitalizations now in Quebec are due to people not having been vaccinated. That's a burden on healthcare workers, a burden on society, which is very difficult to bear, and for many people, difficult to understand.
You're going to be seeing a lot of that clip because it is such an important one. The federal government deciding that it's up to the provincial governments in this country to figure out whether you should get vaccinated, not your own choice. That's basically what he's saying there. And how the government is rationalizing this is by saying that, well, your burden on the healthcare system is, if you are unvaccinated, higher than if you're vaccinated.
50% of hospitalizations now in Quebec are due to people not having been vaccinated. That's a burden on healthcare workers, a burden on society, which is very difficult to bear, and for many people, difficult to understand.
Inoculations support those who are at risk of seeing important surgeries and treatments canceled because our health systems are getting overrun. Are they overrun, though? And if so, by who? Here we can see, this is Ontario, in hospital, but not in the ICU. Unvaccinated cases, 674. Partially vaccinated cases, 163. Fully vaccinated cases, 1,813. In the ICU, unvaccinated cases, 157. Partially vaccinated cases, 19. Fully vaccinated cases, 167. However, let's not forget, we don't know the exact percentage, but some of that 157 lumped in with the unvaccinated are people where symptoms started between 0 and less than 14 days after receiving the first dose of the COVID jab. And here, available adult ICU beds, we can clearly see adults in ICU due to non-COVID reasons, 1,340. Adults in ICU due to COVID-19, 497. Are the hospitals overrun? And if so, who are they filled with?
And I see in my own province, 50% of hospitalizations now in Quebec are due to people not having been vaccinated. That's a burden on healthcare workers, a burden on society, which is very difficult to bear, and for many people, difficult to understand.
Well, they do what's called modeling, and we know how well that's worked out for almost 2 full years now, which seems rather odd, doesn't it? I mean, anybody with common sense and logic would ask, after 22 months of this, why are we still using modeling when we have 22 months worth of solid data? We have data. And modeling is nothing more than estimates. Another way to say estimate is guessing. And they're telling you this, that these are estimates. And these estimates forecast some scary, scary stuff for those of us who think and read. or are called unvaccinated. As you can clearly see, these are some scary guesswork we got going on here. Estimated rate of COVID-19 cases per 1 million inhabitants per day in Ontario. Estimated. Even though we have almost 2 full years of actual data and real-time data from the government itself. Why aren't they using this stuff? You can clearly see by these numbers. They don't match up with the guesswork right here. Let's see if we can spot the differences. Unvaccinated. Jabbed. That's what their guesswork is telling us. But facts tell us a completely opposite story. And let's not forget, when we're looking at ICU, unvaccinated versus fully vaccinated, that their definition of unvaccinated cases also includes where symptoms started between 0 and less than 14 days after receiving the first dose of a COVID-19 vaccine.
50% of hospitalizations now in Quebec are due to people not having been vaccinated.
And even here you can see adults in ICU due to non-COVID reasons, 1,330. Adults in ICU due to COVID-19, 515. Certainly doesn't match up with their estimates. But here's where it gets interesting, right? And this was updated as of yesterday. Staff positive for COVID-19. 511 fully vaccinated staff have currently tested positive for COVID-19 versus 132 patients that may or may not be vaccinated. That is just slightly under 4 times as many fully injected staff as there are patients.
50% of hospitalizations now in Quebec are due to people not having been vaccinated. That's a burden on healthcare workers, a burden on society.
And just to add one more little wrinkle to this hospital narrative, overcapacity is absolutely nothing new. Here you can see hospitals overwhelmed by a surge of flu cases. January 12th, 2011. Hospitals overwhelmed by flu and norovirus patients. January 10th, 2013. Ontario ERs overwhelmed as flu hits harder than usual. December 29th, 2014. Capacity of Ontario hospitals being stretched. May 21st, 2016. Ontario major hospitals operating over capacity, documents reveal. May 26, 2016. Surge in patients forces Ontario hospitals to put beds in unconventional spaces. April 27, 2017. Hospitals say spike in flu cases across GTA leading to dangerous overcrowding. January 23, 2018. Years of restraint straining Ontario hospital system. December 20th, 2019.
But what we see now is that our healthcare system in Canada is fragile. Our people are tired. And the only way that we know to go through COVID-19, this variant and any future variant, is through vaccination. 50% of hospitalizations now in Quebec are due to people not having been vaccinated. That's a burden on healthcare workers, a burden on society, which is very difficult to bear and for many people difficult to understand.